Good afternoon. Thank you for watching our live briefing for Tuesday, October 20th. Today, we're back in the TV studio because of some ongoing construction and repairs that are happening in the Sarah Bell November Theater. Today, I have a brief COVID update and a couple of additional pieces of information I'm going to share with you. After myself, I'm going to introduce a new provider that you'll be introduced to today. And then Glendon Kemp from Security has an update, followed by Vanessa Perry from Pastoral Care. Now, real quickly, in terms of the COVID situation, nationally, you're probably seeing on the news that the positivity rates and new cases are increasing in a number of areas across the country. But here in Virginia, our positivity rates are staying relatively low. The statewide positivity rate's at 4.8%. And it's been pretty stable. We haven't really seen it go up or down over the last few weeks. More locally, it's steady in Henrico at 3.9. Richmond's at 3.7. Chesterfield is rising over the last 10 days or so. It's at 5.8. And Chickahominy, which is Hanover and Goochland, is at 4.5 and pretty stable. Now here on campus at Westminster Canterbury, we are continuing each week to test all of our residents and staff in Parsons Health Center. That testing happens each week, and thankfully for the past 2 weeks, all of our results coming back have been negative. Assuming that continues over the next couple of days, Parsons Health Center third floor will come out of quarantine on Thursday of this week, the 22nd. You'll remember that quarantine was from a positive staff member who had tested positive during one of our routine testing, and she was asymptomatic when she tested positive. Also last week we shared that we'd had an employee in our Child Development Center test positive for COVID-19, and subsequently our virtual classrooms, 2 of them, and a toddler room are closed, and those kids and the teachers are in quarantine until Tuesday, October 27th. Since March, just in summary, Westminster Canterbury's had confirmed cases of COVID-19 in 15 residents and 34 employees. All the residents have recovered, thankfully. And this week, another of our employees has tested negative twice and returned back to work. So far, 31 of our 34 employees have recovered, and 3 continue to recover in quarantine. There is probably the most frequently asked question around here right now is what's happening in the world of vaccination, COVID vaccine. There is a lot of discussion and planning at the state level and at the CDC, and Westminster Canterbury has been actively engaged in those conversations in the preparation. But we want to be clear, no date or specifics about when it will be made available is currently out there. We just don't know yet. We do know that we will be early in the distribution and that we will have an outside pharmacy partner who helps us deliver that, but we don't know when it's going to be. So as soon as we know, though, we'll put it out to you both on TV and in a memo. Another reminder, we are getting a fair number of calls each day asking me to remind you to wear your mask. It is required to wear a mask for everyone inside the buildings here at Westminster Canterbury, and it is highly encouraged that you wear a mask outdoors, especially if you're going to be near others. If you're going to be near other residents or near visitors or staff, it's a good idea to wear a mask. Outdoors, if you're concerned at all, just wear your mask. It's really for your protection. The mask is going to protect you from others who might not be wearing a mask. So if you're concerned at all, just wear a mask and you'll stay safe. The other thing about being outdoors currently, it's beautiful, and so we want you to be outside. But please be careful. We have a roofing crane that's outside the courtyard apartments. Be careful moving around that. And we're also doing a number of sidewalk repairs right now. So please be careful when you're moving around the campus. There's just a lot going on out there, and we don't want you to get injured. So be thoughtful of that. Next thing I want to share with you is remind you, if you haven't seen it in the tales, that we have a new program starting up. So if you haven't seen it yet, there's an important event happening tomorrow afternoon. It's the start of a new monthly live television show, which we are calling Who Knew? As you know, you live here, often new residents move in, they meet their neighbors after moving in, but really you wind up knowing very little about the people that you live with and the fascinating lives that they've lived. Who Knew will be a new series live on TV 970 that will help you become more familiar with one another. On the third Wednesday of each month, that's tomorrow, one of our residents will be interviewed live at 3 p.m. on TV 970 with a chance for viewers to phone in questions live at the end of the interview. The program is being coordinated by residents Ann Archer and Bob Kluel. Tomorrow, October 21st at 3 p.m., we will present our first guest, Scott Boyer. Scott will tell us about his long association with the performing arts here in the Richmond community. Be sure to tune in, ask your questions, call extension 6319 with your questions when the interview's over. So don't forget, tomorrow at 3 starts a new show. I think you'll really like it, called Who Knew? That's it for me. The next thing I want to do, though, is introduce you to a new provider that will be serving our campus. Initially, this provider will be serving residents through telehealth, so virtual appointments, but eventually, as things settle down, we'll get him here on campus. I want to introduce you to Dr. Andrew Heck, who's a geropsychologist and who's now serving our community. After Dr. Heck, Glendon Kemp will be with you. Dr. Heck?
Thank you, John. It's a real joy for me to be in this community, to be at Westminster Canterbury. I just wanted to introduce myself and familiarize people with a little bit of what I do. I'm a psychologist by training, and I'm a specialist in working with older adults. I have worked with older adults for my entire career, and I've been doing it for over 20 years. I work with people in the community. I work with people in facilities, other types of places. So this is a wonderful opportunity for me to get to know a whole different group of people. People ask a lot, what is psychotherapy or counseling? And at its essence, it's a talking cure. They're conversations with a trained professional. It's nothing magical. There's no secret sauce. It's just talking with somebody who knows how to have meaningful discussions and help you get where you want to go. It's a very supportive environment. There's a lack of judgment. It's confidential with very specific exceptions, which we would talk about as we go along. I coordinate with other professionals when it's necessary, physicians, psychiatrists, nurses, other professionals who would benefit and whom my patients would benefit from me coordinating. And of course, we do all that with everybody's consent. This kind of work is covered by Medicare, Medicare plus supplemental insurance. If you don't have supplemental insurance, there may be a copay, but we would talk about all of that when we need to. But at least 80% of it is covered by Medicare, even if it is via telehealth. The sessions are usually 30 to 45 minutes, really kind of depending on what the needs are. And right now, as John had said, we're doing telehealth visits really only from a risk management perspective, and I hope to be able to get into the facility to meet people in person and work with them in person just as soon as possible. Obviously, it's a kind of a complicated affair, and we want to get those things in place as soon as we can. So who would come to me? Well, people across the spectrum. There are people with serious things going on, and there are people with simply concerning things going on, and everything in between. Even in the best of times, forget the pandemic for a second. Even in the best of times, we have general life struggles, family issues, relationship issues, emotional issues, feeling low or irritable or pessimistic or worrisome about lots of things. Sometimes they're things that have been going on somebody's whole life. Sometimes they're things that are new, that have just come up. Medical and health issues, many people struggle with those as well. Sleep difficulties, there's a lot of reasons people can have trouble sleeping, and sleep is so fundamental that we want to make sure that it's part of a person's good medical care. Memory difficulties, and this is a big one. People ask, is this normal? And we can try to help answer that question. So those are things that happen in the best of times. And in these, let's call them extraordinary times, that adds a whole different layer of complexity. People have a fear of illness. People have feelings of isolation and boredom, disconnection to loved ones because they haven't been able to see them, or in some cases talk to them very much. A lack of productivity or purpose. People spend a lifetime doing things that are meaningful to them, and kind of all of a sudden that has been cut short. And people have a lot of feelings about that. And rest assured, I work every single day with people who are experiencing that. And other things that we might deal with could include formal evaluations. I do a lot of memory evaluations. And some of those might take place at my clinic, which is actually in Midlothian, Virginia, only because, to be quite honest, that's where all my stuff is. But we can do those evaluations. Sometimes we get involved if there are legal proceedings, guardianship issues, conservatorship, sometimes kind of complex issues. And then something called geriatric care management, which actually my practice partner, Courtney Petley, does. And this is basically just assistance in navigating complex care issues. Maybe there are financial, maybe there are legal, maybe there are practical medical issues that are really difficult to navigate for a family member or for other loved ones. And we can help with that. How do people access our services? The best first thing to do really is talk to your doctor. Your doctor can write a referral, and that'll get to me, and we'll set everything up. I know Tabitha and others in the clinic help us with that. I work very closely with Lori Yount, clinical director Lori Yount, to help arrange services as well. So the best thing to do first, though, is to talk to your doctor, and or you can talk to these other folks, and they'll point you in the right direction. But I do need a doctor's order to work with folks. And I guess lastly, people have requested I tell you something personal about myself. I live in Chesterfield County. I'm a father. I'm a musician. I have a band. I play music in a band. I'm a woodworker. I'm an avid motorcycle rider. And I've been doing what I do for a long time, and I really, really love it. So I'd be happy to meet you if it's something that you need. Talk to your doctor, talk to your nurses. They'll point you in the right direction. But I'm really, really happy to be here, and I look forward to seeing some of you very soon. So I'm going to turn it over now to Glenn from Security.
Good afternoon, everyone. And Dr. Heck, welcome to the Westminster Canterbury family. I have several comments for you today. The first thing that I would like to talk about is election security. I know that many of you are concerned about the potential for civil unrest with our upcoming election. Although we do not expect civil unrest to impact our campus, as it's usually directed at historical landmarks, we recognize the potential is slightly raised with this particular election. Plans are in place with the Security Department and Henrico County Police to handle any situation on voting day and beyond. Next, I'd like to talk about the emergency nurse call system in the Tower, Garden, and Glebe. Westminster Canterbury is proceeding with replacing the current emergency nurse call provider, which is called HealthSense, to Sarah. Tower, Garden, and Glebe residents can expect a memo to come out near the end of this week with details on the switchover. Two things I want to mention here. We anticipate installation to begin November 16th, a Monday, and the industry is moving away from motion sensor check-in systems, as they have shown to be a liability. We will be installing door contact check-in devices, as they are much more reliable. Next, I need to make a comment about private deliveries and service workers. It has been rare, but we have come across a few private delivery and service workers who have not either gotten screened or are wearing a mask. While the gate officers are very clear in giving these folks instructions when they come through the gate, it is imperative that you are clear with them before they arrive and that they must go through our screening process to keep their masks on at all times. If we find these folks without wearing masks or wristbands, they will be removed from property, which means you may not get your delivery or the service work that you need done. Also, if you should see a delivery driver or service worker either not wearing a mask or not having a wristband on, we would like you to report it to security immediately. Next, a comment on overnight visitation. This is just a reminder that there is a check-out process for your overnight visitation guests. Please either sign out at the tower or center desk where you signed in, or dial 0 from a resident's phone to inform the desk that you will be leaving. We need this information for tracking purposes. Lastly, it's not unusual for me to talk about scams. We continue to see scam calls from people claiming that your Social Security information has been compromised and your account is about to be closed. Remember, the Social Security office will correspond with you through the mail only. A new emerging scam is scammers claiming to be from Apple. A few residents have received calls from people stating that they are from Apple and that your information is being used all across the country. Apple does not call their customers to report potential fraudulent activity. They use push notification technology instead. If you have questions, please call me, Rob Robertson, or security at extension 1111 if you have questions or ever need assistance when it comes to potential fraud issues. All right, that's it for me. I'd like to bring up Vanessa Perry. Thank you.
Good afternoon, everyone. We hope you enjoyed the service of dedication for the new spiritual center. If you missed it, don't worry. It will be shown again on TV 970 tonight, tomorrow night, and Thursday night at 7:30 p.m. The entire broadcast lasts about an hour and a half. The first hour or so includes greetings from our CEO, John Burns, and our two board members, Russ Aronson and John Thomas. Pastoral Care Director Lynn McClintock shares a brief journey of how we have grown over the years to this exciting moment in our history. Our chancel furniture designer, Eric Thompson, then describes his beautiful creations that adorn our new sanctuary and the pulpit for the new chapel. It is after these important presentations that the service of worship begins. Many of you have already commented on the inspirational sermon by Reverend Dr. Brian Blunt, who's the president of Union Presbyterian Seminary, as well as the beautiful music by our resident musicians and the Ginter Park Presbyterian Church Choir. The pastoral care team truly loved putting the service together for you as an offering of love and appreciation, and we hope that you will tune in this evening, tomorrow, or Thursday, again at 7:30 p.m. on TV 970. Please also join us in worship this Thursday at 10:30 a.m. via TV 970. The minister will be Reverend Fletcher Lowe, with Logan Augustine assisting. The pianist will be Susie Frazier. A reading from Proverbs 11:14. Where there is no guidance, a people falls, but in an abundance of counselors, there is safety. your peace. God, who is more than we can ever comprehend, help us to seek you and you alone. Help us to stand before all that we could do and seek what you would do and do that. Lift from us our need to achieve all that we can be, and instead surrender to what you can be in us. Give us ways to refrain from the busyness that will put us on edge and off center. Give us today your peace. Thank you for watching, and join us again on Thursday at 3.